Hello, today's topic we're going to be talking about toy breed radial ulnar fractures in our toy breed dogs. This can happen in any breed. It can even happen in cats. It just tends to be a lot more common in our Pomeranians, any dog that's less than like 10-15 pounds. Been seeing a lot of these lately, so that's why we're going to talk about it. I explain it as a lot of these little Pomeranians, little Shih Tzus, little Dachshunds, those kinds of breeds, they Superman all the time, especially when you get them, they're young puppies. But one of the most common fractures that we deal with in those guys is a forearm fracture, so the radius and the ulna fracture. Now, there's a variety of reasons for that. Is there a genetic component? To an extent, yes, but it's more genetic predisposition is what I would word it as. And they're just such small breeds that their bones are so small and they Superman off of beds, couches, stairs, whatever. I mean, they play hard. Large personalities for these itty bitty little fuzzballs, dust bunnies. And when they land wrong or something, they just snap. And it's a very common fracture. I want to say it's about, different studies have said different numbers, but probably about 70% to 80% of the toy breed forelimb fractures. So hands down the most common. Some of it is small bones. The other big part is they just don't have great blood flow. That's not necessarily an issue for predisposing to the fracture, but more of an issue with when we're dealing with repairing the fracture and how to repair it. Those toy breeds, they're just not great with blood flow. And you've got to have blood when you're healing bone, healing tissue, healing all those things. The next big issue we deal with is plating is hands down the gold standard at the moment, best way to fix the majority of these guys. And you're talking about putting a plate and screws in multiple of them into toothpicks for the most part. I am exaggerating a little bit, but the dogs that tend to be less than about 5 pounds really do have like 2 or 3 diameter width of 2 or 3 toothpicks wide of bone to deal with and work with. And sometimes when you drill holes in bones, they're not a big fan of it, especially if they don't have good blood flow. So basically just those small breeds, toy breeds, the smaller they are, the more predisposed they are to having complications during the healing process with radial and ulnar fractures in the front limbs. One specialist that I heard from, highly renowned, I'll leave his name off, here in Texas in a private practice, said in his practice, numerous other specialists, not just him as well, orthopedic guys, they would see as much as 70% complications in these toy breed forelimb fractures. Now, with that being said, there's a variety of what a complication is. Complications can be as simple as a rash from the bandage or sore or something like that. Skin infection has nothing to do with the plate or the bone. But those also do get factored in there. So my point is, for those of you that have these real small dogs, toy breeds, kind of the smaller you get, the more at risk you are for this. Just be aware when you're going into those, where you take it into your veterinarian, they are at a higher risk of complications just because of the anatomy and how they're predisposed. There are some things that we can do in the profession to try and increase the blood flow and minimize the risk in that and some of those complications, but it's very hard when you're working on small little toy breeds. So just know what you're getting into if you're going to go that route, and hope that helps you guys. Have a great rest of your day.